Welcome back. Thanks for staying with us. You're watching Tech Hub, the TV show for all things tech in Africa. The Central Bank of Nigeria, CBN, has launched a new Naira payment solution aimed at enhancing payment turnaround time for ministries, departments, and agencies by 70%. This new solution, unveiled alongside a digital document management system named DocFlow, is set to streamline financial transactions and improve customer support within the public sector. The MDA Naira payment solution is considered a game changer in the CBN's financial transaction management and is projected to cause a 70% improvement in payment turnaround time and further improve Nigeria's financial ecosystem. And our next trending story is that history is about to be made with the launch of Nigeria's first artificial intelligence-focused university in Ekpe, Lagos State, Nigeria. This bold vision is to position Nigeria as Africa's major player in the $4.6 trillion global AI market. This initiative aims to equip Nigerian youth with skills in AI, blockchain, quantum computing, data science, machine learning, and generative AI. The Winnie University, which is the name of the school, is to transform the continent into a global hub for technological innovation. I'm excited about this news. I know the first ever AI university is in Qatar, but we have one coming up in Nigeria soon, and we hope that this would address unemployment by equipping Nigerians with the latest and the best in AI skills, positioning us as a nation to be reckoned with in the global AI market. This university is largely inspired by the success of the first AI university in Qatar, which has attracted top scholars and innovators from around the globe. Winnie University, when established, will empower Nigerians to create groundbreaking solutions that will transform industries and economies and position youths for leadership in the rapidly evolving global AI markets. Nigeria's healthcare system faces numerous challenges, from inadequate infrastructure and limited access to care. And also, there are many inefficiencies that hinder delivery of healthcare in Nigeria. However, in the face of these challenges, innovative technology is emerging as a powerful tool to break the bottlenecks and revolutionize healthcare delivery in our nation. Our guest today is a renowned expert and advocate for digital transformation and innovation in healthcare. He has been at the forefront of driving the adoption of transformative solutions that addresses the inefficiencies in Nigeria's healthcare system. He is the country lead and global head of strategy at Thalamus Health Incorporated. Without any further ado, ladies and gentlemen, I want to welcome our distinguished guest, Joel Adirinto. Hi, Joel.
Hi, Ken.
It's a delight to have you on the show today.
Thank you very much for having me here today.
So let's dive right in. Tell us about your journey. How did you venture into healthcare tech, or health tech, as it's called?
Tech. I mean, so I have my background in the medical sciences, and I like to consider myself as somebody who always seeks out innovations in whatever I do. So I've always had this flair for anything innovative, technology inclined. So I had like an 8-year run in the pharmaceutical industry, and while I was at it, I always sought out opportunities to leverage innovation to kind of drive business processes and improve business performance, and that kind of led me into Thalamus Health, where I came on board fully to start running a digital health company, kind of solving the inefficiencies in the healthcare space and seeing how innovation can help to address some of those challenges.
Now, there are many inefficiencies in the healthcare service delivery in Nigeria.
Yeah.
Too many of them to start recounting, but what are the main ones that that come to mind for you?
Yeah, so if we're going to look at the inefficiencies in healthcare, you want to think primarily, first of all, about funding. Okay, so the Nigerian healthcare space is generally underfunded. I mean, if my memory serves me right, Nigeria devotes less than 5% of our budget to healthcare.
Sadly.
And this is far below the recommended WHO's 15% that's supposed to go to healthcare. So what that does is that it put a lot of strain on the healthcare system because there's not enough infrastructure, the equipment that are required are not available, we are not able to pay people well, so that kind of leads to infrastructural challenges because some healthcare centers don't have power, for example. they don't have electricity, they don't have medicines they're supposed to use. So that funding gap is a very big challenge, which leads to infrastructural challenges. Another very major one in the Nigerian healthcare space is the shortage of healthcare workers. You and I are quite familiar with the brain drain that has occurred in the healthcare space, where we've had some of our best and brightest healthcare workers, doctors, nurses, leave the shore of Nigeria seeking greener pastures in the UK, in the US, Australia, and Canada. For a system that's already underfunded, what that does is that the people who are left behind, they are overworked and underpaid. And ultimately it kind of directly impacts on the kind of care they can provide, because a doctor walks into a facility and sees much more patients than he can actually attend to within the time that he has. What's going to happen? He's just going to breeze through the patients, because he wants to get done as quickly as he can. So these are some of the challenges that occur for the system. For patients, on the other hand, their own major challenge is the challenge of access. Having right access to care, having prompt access to care. The challenge behind having prompt access to care is because a lot of people delay seeking health care until it's too late. And why is that? Because there's a funding problem as well. So we're seeing a lot of work being done by health insurance agencies to kind of sell the idea of health insurance, because that kind of helps you when you have that critical ailment and you need to see a doctor, but you don't have the money. It saves you from out-of-pocket expenses, which actually can drill a big hole in your pocket when you don't have it. So
there's a lot to dwell on. Now, you talked about funding. You've talked about the fact that even the system is understaffed.
Yes.
And there was a video recently going viral, Apoko doctor,
I saw that
showing
one.
a video about a hospital, primary healthcare center actually, not even a full-fledged clinical hospital.
Absolutely.
That's a primary, this most basic healthcare service, whatever.
That's the bedrock of healthcare in any country. It's the primary healthcare system.
And they only had one faucet. Is that what it's called? In the entire primary healthcare center.
Yes.
There was no power whatsoever. They used their flashlights.
Exactly.
Now, that's a lot to handle. And I'm thinking, let's not dwell on the negatives. What are some of the innovative technologies right now you are aware of that have come into the fore and is helping, at least from where we are right now?
So if you think about patients and think about the problems that patients have, which I described earlier, the major one is the challenge of access, accessing healthcare. Some of the technologies that we've seen in the Nigerian space that have worked are telemedicine solutions. So especially in rural areas where...
And that came up since after COVID?
Since after COVID. I think COVID kind of strengthened the use case for telemedicine. Yeah. Because prior to that, I'm sure there's been solutions. I mean, at Talamos Health, we do have a telemedicine solution as part of our full suite of solutions. But it was not as adopted as you would have expected until COVID happened. And it wasn't just telemedicine. Services like Zoom, and all of that for teaching in classrooms and having meetings, because we all had to stay at home. But staying at home didn't mean that our businesses had to shut down. We had to continue to provide services. So telemedicine is one of those solutions that we've seen that has really helped to bridge the gap between underserved areas, rural areas, and cities. One of the major problems I forgot to talk about earlier is the disparity between the urban and rural areas, and even public and private areas. If I'm a doctor, I've spent the number of years I've spent learning to be or training to be a doctor. What happens is that I would rather find myself in an environment where I feel more rewarded for my services, which is in the urban areas, than me going to a rural area. So what happens at the end of the day is that rural areas don't have enough doctors. There are some specialties that you would not find in certain rural areas. So how do we bridge that gap for patients who probably need to talk to a cardiologist or an endocrinologist who's in the big city? Do they have to travel all the way to the big city? Or can we provide a technology that with a minimum internet service can allow that interaction, supervised, of course, by a healthcare worker in that rural area with a doctor in the big city? And that really has helped a lot that we've seen. I mean, telemedicine. Other solutions that we've seen in the space are electronic health record systems. EHRs or EMRs, as some people like to call them. These solutions primarily help to digitize the operations of the facilities. So if you walk into a facility, for example, and it's the traditional way of caring for patients, what you find is you have to get a card, they have to open a file for you, they write your name on it, fill out your details, and then a nurse takes that file through all the different service points within the facility. The data in that paper, you can't use it as much because for you to make sense of that data, somebody has to sit down with it and then transcribe it onto a system to be able to use it. So there's rooms for error, okay, whenever you have this kind of system. So EHR systems have come to help to smoothen that inefficiency within the facility, okay, because patients just come in, you don't have to start searching for their paper files. If you walk into some clinics, Ken, a lot of them have 20,000, 10,000 folders of patients that whenever you walk in there and you say, oh, I want to see a doctor, they have to go scramble through those folders, through that shelf.
And if they can't find it, they ask you to buy a new card.
Exactly. Which also leads to another problem, the problem of duplicity of records. You know, so using an EHR system, you just come in, you mention your name, you type your name in there, and then you can continue your care. Kind of smoothens that process. It reduces the patient's waiting time, which ultimately, you know, improves patient satisfaction with care.
Can even be life-saving.
Oh yes, absolutely. Because if I don't have your record as a doctor, I can't commence care because I have no idea. You know, what are your past medical history, surgical history, and stuff like that.
And let me chime in on something you mentioned here. You talked about the fact that there's a disparity, you know, when doctors, you've spent many years in school.
Yes.
You want return on your parents' investment.
Of course.
So you don't want to go. You want to go to a private clinic or hospital to practice.
Yes.
Now I remember a short while ago, the Nigerian Senate was proposing a bill to stop medical students from going to practice outside the country. I think that was a bit off point. Where they should channel that energy to should be, what do you think? I was thinking, instead of asking people to stop traveling, have them serve compulsorily in areas where they normally would not have access to a doctor. I think, what do you think? What are your thoughts around that?
I mean, I heard about it, to be very honest, and I personally feel that education generally in Nigeria is subsidized, let's be very honest. Especially if you access education in a public university, is very hugely subsidized. If you look at what it costs to train a doctor in a public university vis-a-vis what it costs to train a doctor in, say, a private university, you understand that the gap is very wide. So yes, the government needs to get some value off that subsidy before people, see, we can't stop people from accessing career opportunities anywhere else in the world. You know, people will always travel, and it's not just a Nigerian problem, it's a global problem, because immigration is a global thing, okay? But what I think that we can do is to help those doctors who we're training, you know, have a sense of giving back. Do you understand? Some people do give back before they make the move. Some people give back later in their career. So we have people who, they've studied here in universities and they've traveled abroad, spent some time, gained some expertise, are now orthopedic surgeons and stuff, and they're coming back to Nigeria to now provide their services at almost next to nothing, because their services here in Nigeria would not equate how much they would get paid if probably they were doing that surgery, say in LA or something like that, you know. So those are the ways I think that the government can actually think about it.
You mentioned some technology that has come to help the healthcare system. Now, can you share the barriers that have come up to adoption of these technologies to help our healthcare system?
So I think one of the major barriers is still an infrastructural barrier, and that's with things like electricity, internet access, and all of that. Because when you think about digital solutions and technology, you want solutions that offer some kind of real-time possibility. So I'll give you one example. My organization has done some work with Lagos State, helping to digitize the primary healthcare space. What the experience was like before we stepped in to do that was that a patient who probably visits, say, Ifakojai Primary Healthcare Center can get registered in Ifakojai Primary Healthcare Center. If they lived in that area for 3 to 5 years and then they moved somewhere else, it becomes a problem because they don't have your previous record, and there's no way they transfer records from one PhD to the other, so a new file has to be created. the entire history of that patient in the previous place
Lost.
is gone. Not only is it gone, he has created a duplicity of that patient, and it happens in multiple places. That data is not useful because the administrators of care within Lagos State primary healthcare system need visibility, real-time data into what do the numbers look like, where is the burden of disease located, where are these symptoms being reported, and things like that. So having a system that runs real time helps to provide those kinds of possibilities. So internet is very, very useful. Although I would dare say that there are solutions like ours, that offer offline first capabilities. So what that means is it's not heavily reliant on internet, okay, even though you do need internet to kind of sync with other facilities, but within the facility you can run your operations necessarily without internet. So internet is a challenge. Electricity is a challenge. We're seeing that being solved now with alternative sources of electricity. You have solar panels, inverters, but people are going alternative these days because the cost of electricity is high. The cost of fueling generators is also very high. You can't buy diesel to run your generators, these days. So there are alternative sources as well. I think another barrier I can think of right now is also the awareness of the healthcare workers themselves to technology. Okay, from our own experience working in the primary healthcare space, we found a lot of people who are not very tech savvy, so they don't really know how to use technology solutions. Okay, to solve that, one of the things that we've done from our end is to make sure that whatever solution you are building is human friendly. So you employ a human-centered design kind of approach to make sure that anybody who can use a smartphone, who can send a WhatsApp message, who can click and enter anything, should be able to use your solution.
So as basic as possible.
Should be as basic as possible. That way you can get anybody at any level of literacy to come on board and use the solution. But another thing in the long run, which I think that government needs to look into, is how do we inculcate digital literacy in the curriculum of students who are in medical school, for example. Okay? Because the world is moving very fast. Things like artificial intelligence, data analytics, and all of that. How do we bring that early on? So while students are taking their courses in anatomy, physiology, and all of that, how do we introduce some of those learnings for them, either as a nurse, as a biomedical engineer, or as a pharmacist, so that when they're done from studies and then they graduate, they're not new to these technologies, and they kind of have already a fair idea of how these things work.
Now, this is a lot to handle. Now, I'm thinking, several things are running through my mind. How important is collaboration between the private sector and public sector in driving efficiency in healthcare delivery in Nigeria, and not forgetting international partnerships as well? Yeah,
so it always has to be some kind of PPP arrangement. So the public sector, they're supposed to come on board with things like providing the framework, the regulatory framework, providing the infrastructure. The private sector comes with technology expertise, okay? We know how to design these solutions. We know how to deploy these solutions. We provide trainings for the staff in the public facilities, and that way we're able to have a synergy that works, okay? But the enabling environment needs to be provided. We need to see a lot of openness from government into adopting these solutions. Yes, we know the challenges are there. The challenges are always there, Ken. It's quite heartbreaking when you see facilities that are still struggling with things as basic, as having a faucet, for example, no water in the facility, in a primary healthcare center, So that collaboration needs to be there. Also, some private sector players can come in with funding, and that's where international partners come in. We've seen a lot of funding coming in from like the Gates Foundation, Gavi, providing vaccines. They even go the extra mile to even help provide some solar infrastructure that helps to keep the refrigerants or the refrigerators that keep these vaccines safe and durable over the period of time. So those are the kind of things that I feel that can work out. There can also be some learnings, okay? So some partnerships, say MIT or IBM, just to understand what are global best practices for deploying digital health solutions and things like that. So yeah.
But now, your comments leads me to something that's going through my head, and it's the fact that The United States has pulled out of the World Health Organization.
Yeah.
And before now, with open knowledge that they've been the largest donor.
Yes.
Do you see that affecting foreign sponsorship or partnership from WHO? Since the United States is taking a back seat right now, backpedaling on funding the WHO, and most of these grants and funding come from WHO. Do you see that affecting global healthcare delivery?
I think in the short time it would, because there are already some programs that are running, okay, that are being currently funded. So just pulling the plugs that way would definitely have its effect on some of these programs. You know, we also heard about some cuts happening with USAID, pulling back on funding, you know, to the healthcare sectors in certain countries. You know, I think in the short term, that's going to have some effect. But in the long term, countries need to find sustainable ways to keep their interventions going. I think this is just an eye-opener for a lot of countries' Ministry of Health to start looking inwards, start looking locally as well. You know, how can we source and raise funding to keep some of these interventions going and not necessarily depend overtly on external funding, you know. So people have to start looking inwards and start thinking very innovatively regarding funding.
All right, so I just have two more questions and I think we'll wrap this up. So I'm thinking in terms of policies and regulation, what policies should be in place right now so that, let's just talk about efficiency of policy.
Do we have a dearth of policy? No. There are lots of regulations. So I'll give you one example. There is the Nigerian Data Protection Regulation, for example, that mandates any organization that manages data, collects, stores or manages data up to any certain number to make sure that they are registered and that they are frequently audited. Okay, so that regulation is there. But the question is that being followed through? Yeah. Okay, I mean, just take your mind back and just remember the time when Nigeria was struggling with drivers not wearing seatbelts. Yeah. You know, there had to be that firm, you know, punitive measure if you are not putting on your seatbelt. Now, think about it. Putting on a seatbelt while you're driving as a passenger is not in the interest of the road safety corps marshal or the guys who are on the road. It's in the interest of the passenger who's seated in the car. You know, but still, people had to be forced to use their seatbelt. So these laws are there. There are a lot of regulations out there that I think that the government needs to just strengthen and enforce. But there are other areas that I think the government can actually look into. Tax breaks for startups, for example. I mean, it's called startup for a reason. You know, tax break for startups, provide some kind of funding, partnerships with maybe telecom players, you know, to probably provide some subsidized data for healthcare facilities, especially the ones in rural areas, you know. I mean, there are a lot of areas that we can go into today, but just because of time, we won't be able to. So
I think I just want to wrap up with asking, what advice do you have for anyone looking to go into tech, more so health tech? What advice would you give to a younger person?
Yeah, so I would say you have to think, you have to be very innovative. You have to think about the patient. Think about the people that you want to solve the problem for. Okay, put yourself in their shoes. Okay, and make sure that your tech is tech for good. Yeah. So there is tech that solves traditional problems, and there's tech that solves tech problems. You see, with the advent of AI, we're going to have lots of tech problems. I'm going to give you an example. So parents now are grappling with screen time for their kids to say, hey, fine, we're giving them tablets to use, but that's now a problem. Yeah. How are we solving it? I've seen solutions that says if a kid is watching his tab for a few minutes, it interrupts and asks you some mathematical questions that you have to answer. If you don't answer it, then you cannot continue. You know, so tech for tech, also in areas of, you know, AI-generated content that we don't know whether it's real or it's AI. We need tech to help us decipher whether it is, you know. So just be very creative and innovative in whatever it is you're doing.
Joel, it's been a delight having you on the show today.
Thank you very much.
I mean, I can't wait to have you back again with these conversations. That there's no end in sight for discussing this. And you mentioned some areas that are very particular to us on the show. We've always announced and always talked about tax breaks for startups. I mean, the regulations and tax policies need to be revamped. So I want to thank you for joining us. I want to thank our viewers for watching today's edition of the show. Remember to follow us on social media to continue the conversation, and join us same time next week. Until then, remember, technology is a force for positive change. The future is limitless. Bye for now.